So I'm hoping they're saying, because she looks really good, but I am fine, thank you, and the weight I've lost was by choice, okay? All right. By a show of hands, if you don't mind, how many of you are caregivers for someone other than someone who's diagnosed with cancer? Wow. Wow. Well, that tells us a lot, and that's a lot of great feedback for Bill and his team and for Eisenhower, because we need to be providing more for you guys. We're obviously not giving you enough that you need, so that's great feedback, and we will make sure that our administrators get that feedback, okay? All right, well, let's see if we can get started. So I did want to explain that the title of this is a marathon, not a sprint. And for those of you in the caregiving role, you totally get that, right? It's something that takes time. It's the reality of caregiving in the United States today is changing every single day for a variety of reasons. We just heard now that our government is not extending insurance in the Affordable Care Act. This is not about politics. This is about understanding that it will affect all of you in one way or another, and it will affect caregivers as well. So it's an ever-changing area of concern for all of us, especially those of us like me who are getting older. Oh, I do want to say one other thing. I left myself a note too. It's having a moment right now also. I don't know if you've realized or seen that, but in the newspapers and on TV and in ads, there's a lot going on about caregiving. So make sure you're reading and asking and understanding what's changing and how it's going to affect you. We're going to talk about this, so I have objectives tonight. I hope we meet them all. And if we don't, interrupt me. Say, well, Alison, I was really kind of hoping you were going to talk about this. You haven't said one word about it, and we'll do our best. And I have 3 experts in the back of the room to help me as well. So, but we want to understand what we're here for tonight. This is what I'm going to try to do. I don't think I need to read slides for you. But we do want to understand the scope of caregiving in the United States and recognize that the physical and emotional impacts that those of us that are in a caregiving role, what we experience, and what do we do about that, and maybe learn some practical self-care or self-help strategies along the way. And then lastly, hopefully, because when someone used to say to me, well, what do social workers really do? I had a very quick answer. Social workers are like the walking yellow pages. Remember, y'all remember the yellow pages? We're in a room full of people who remember when we got yellow pages, right? That's what a social worker does. That's the core of social work in the healthcare setting, to point you in the right direction, to get you the phone number you need, to get you the agency you need, to get you the care you need. So that's what we're going to do tonight, because I'm a social worker at heart. That's what I've done since the day I walked out of Michigan State University. So we're going to do our best to provide you with some of those resources that we hope will help. And we're going to start off by defining who a caregiver is, because we can't have a conversation together if we're not all on the same page, right? So there's 2 types of caregivers. There's formal and there's informal caregivers. And again, I don't read slides, but you can, because it's all right up there. But as I mentioned earlier, due to changes in the healthcare system and our increasingly older population, the burden of caregiving is increasingly shifting to informal caregivers. Family, friends, neighbors, there's no question about that. And current evidence actually suggests that cancer caregiving, although most of you are not, so I'm going to take the word cancer out of my notes and say caring for someone with a serious or advanced illness, it's intense, it's episodic, meaning there are times in episodes when it's bigger and then it gets smaller and then it gets bigger again. So it's episodic also, and it has a profound impact on the caregiver's well-being and quality of life. There's no question on that. When I was updating these slides, I was surprised to see how the numbers had skyrocketed. And that on average, caregivers spend about 25 hours a week providing care. And a quarter of those that are spending the 25 hours a week, a quarter, of them are providing over 40 hours a week in caregiving care. With the advances in medicine, caregiving has become more complex, and many of us are performing medical tasks without very little training, whether it's providing an injection or it's changing a bandage or it's figuring out medications. This is a huge task, and many of us have never been prepared. Nobody took a class in high school or college on Caregiving 101. So for those of you, if you have Medi-Cal, in the rest of the country it's Medicaid, you have a little more help than the rest of us because there is a program called IHSS, which is In-Home Support Services. And that will cover the cost of a certain amount of hours if you meet a certain criteria and an assessment has to be done. It will cover a certain amount of hours in caregiving. And that's wonderful to know and very important. The hours are limited, but it's something. And they will hire family or friends to do that job. So again, if you have Medi-Cal or live in another state, that's Medicaid. That is something to ask about, IHSS, In-Home Support Services. But before I move on, so we know where caregiver is. We know that caregivers often neglect their own health. We know that it's emotionally and physically demanding. But before I move on, I'd like to know, what's your role in a caregiver? What do you guys see? If I walked up to you and said, so you're a caregiver, what role do you do?
Everything.
Everything. Everything. You are not paid enough, young lady. Absolutely not. Everything.
You're everything. You're the pharmacist, you're the housekeeper, you're the accountant, you're the cook,
Yep.
the shopper, the
Yep.
nurse.
I see all these heads going like this. Mm-hmm. The driver.
Yep.
Yep. Yep.
Uber driver.
Uber driver. What else?
The warrior.
So who said warrior? Good for you. So you go to battle for the person you love as well. Absolutely. We're going to talk about that a little bit, how to make that a little easier. What else?
Psychiatrist.
Psychiatrist. There you go. That's right. Absolutely. And we're going to talk about that as well.
How about researcher?
Researcher. Yeah. 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 Researcher. Yeah. Yeah. Mm-hmm. Anything else? Well, you certainly hit on all the main roles for sure. You listed most of them already. You know, when someone you love is diagnosed with cancer or any advanced illness, you quickly find yourself in one of these roles. And you may not have had them before. And you're providing substantial practical and emotional support. And usually, as you said, everything, it's more than one of these roles that you've assumed. And it really could be a real flip as well. I have permission to do this because my husband's used to me after 45 years. My husband's quite a bit older than I am, and he has some health issues. Well, he always took care of this, this, and this while I worked and had 3 kids, and this was his role because he had a little more leeway in the work that he did to control his schedule. Well, he's not good at this, this, and this anymore. He can still hold on to that, but this and this he can't do anymore. Not at his age with his health concerns. All of a sudden, I'm doing this, I'm doing that, and I'm doing his this, this, and that. So yeah, things change for us, doesn't it? And so we look at the role we have, we look at the toll it can take, and you know, tonight's about the toll and what happens and how can we support you and what you should know. That's what tonight's about. But I also want to point out there are some positives to being in the role of a caregiver. Some really strong, important positives that bring you closer together, that improve communication, that provide worth for yourself and for the other. So we don't want to overlook that. It's just that that's not what hi, Danny, I didn't see you come in. That's not what we're focusing on tonight. okay? But when we talk about the journey, it is in phases. It truly is in phases. You know, we start with diagnosis and treatments. That's where we start. And that's kind of what I have always called the crisis mode. What? What? What do you mean? What are we supposed to do? Who are we supposed to see? When does that start? I don't understand what you're telling me, doctor. We have to which doctor do I go see first? And when's that scan? Well, what am I going to do at home? I work. I'm not sure. And it's just this loop in that first phase. Then we move into the treatment phase. And while uncertainty is up there because we never know what's going to happen when we start any kind of treatments. Will they work? How will I feel? What will the side effects be? But there's also a calming influence on knowing, okay, these are the daily responsibilities now. Now I got it. I understand. So, and lastly, if we're entering into long-term care of someone, or it could be end-of-life care, it could be, right? Well, then we start to go, oh, there's a lot of fatigue and exhaustion going on here. There's a lot of grief. A lot of us we don't even realize that we start grieving early on in our role as caregivers. We're grieving the change in our relationship with the person we love. We're grieving the change for them. We're grieving the change in our life and our lifestyle. Lots of changes when this happens. And then there's also that adjustment period. Okay, this is what it looks like. We're going to get to that, absolutely. Anger and resentment. And we never really hear our professionals talking about that because it's not okay to be angry at someone. You're supposed to love them and put a smile, put on a happy face, right? But you're absolutely right. You didn't ask for this. You didn't bargain on this one happening. Good for you for bringing that up. Thank you. I really do appreciate that. So we talk about the challenges. Interesting. The notes are not matching. I'm glad I printed them out. Hang on, guys. Let me catch up to myself for a minute. There we go. Oh, that's interesting. So these are the challenges we face. They're not new to you. They're not surprising. You already brought them up, and we've already mentioned them. But what I want you to focus on is the results. What happens when we're faced with these challenges? Am I standing in your way? Guys, I'm so sorry. I keep walking forward. You know, what happens when you're emotional stress, you're physically exhausted, the social isolation, again, something we don't talk about often, right? The strains, the lack of recognition and support. But what happens here? So being a caregiver is like a real emotional roller coaster. And tied up in that is a lot of hope, right? But a lot of fear. I talked about some grief. But there's also resilience. There's a lot of resilience. Many of us are like, wow, I didn't know I could do this. But I can. I can. I'm not crumbling. I'm not a puddle on the ground. We're getting it done. And that's important to recognize. Those little wins we're going to talk about later, to give yourself a pat on the back for at least little wins, right, if nothing else. All of these things, though, all the challenges and then the results of those challenges, what happens is it reduces that quality of life that we talk about so much. You know, in the cancer world, it falls often to the social workers to have that discussion about quality versus quantity, right? And we don't hear that discussion as often outside of the oncology world, and I wish we did more because I think it's an important discussion. And your quality of life changes dramatically when you're a caregiver. But also the quality of life of the person you're caring for has changed dramatically as well. And of course, seniors above the age of 65 experience this the most. And the one that jumps out the most, that tends to happen as we get older anyway, is social isolation. And that's not good. It's truly not good. And it happens for a variety of reasons. The caregiver, we're tired, right? We're just tired. One more thing you want me to do? The person we're caring for is not up to going out. They don't want to do that. You don't want to sit. What you really want to do is scream and yell and pull your hair out, but you don't want to do that to your friends and family, so you don't, because you're forever the caregiver of everyone, right? So social isolation is very real. It's also very real as we get older for a lot of just physical reasons, whether we're caregivers, patient, or not. We don't hear as well as we did. I don't know about you guys, but I was privileged to be taken to a lovely dinner at Wally's the other night. I could not hear a damn thing. I just kept going, what? Excuse me, what? To my lovely dinner companion. So that just happens to a lot of us anyway. Some of us don't see so well at night. So we don't drive like we used to, socially isolating more and more. It happens even more so when we're in a caregiving role. Any questions? Am I talking too fast? I'll always be a New Yorker. I can't help it. We're okay? All right, good. Someone said financial when I was asking what the roles are. And I think it's really important as well to recognize how much being a caregiver can change your finances and the dynamic of your lifestyle that relies on income or monies that you need, because there are changes now and things change. Maybe you're working. Now you're not working like you were. Maybe you're not working at all, right? Maybe have to start hitting retirement savings earlier than you thought you were going to. There is a lot of concrete needs that patients or people that you're caring for need that are not covered by insurance. Little things. Depends. Little things. Or big things. It depends. But there's out-of-pocket costs for sure. And I always want to point out, because a lot of people don't know about this, the Child Independent Tax Credit. If you are a caregiver for someone, you may be entitled to a dependent tax credit in your taxes. So I encourage you, if you are fortunate enough to have a financial advisor, to ask them about it, right? If not, you may go to that website in the government, the IRS, to read about, are you eligible for a tax credit? And is it worthwhile in your income or tax bracket? It might very well be. It certainly can't hurt to read about it. Most of us, I hope, most of us plan for life's events. Retirement, travel, college, maybe we have people in here with college-age children or grandchildren. And becoming a caregiver disrupts that. It changes all those life events and what you're going to do about them. And I also, along with pointing out that you might be eligible for a tax credit, a little further on, will share with you that there is a wonderful website for finding out what are you eligible for. Are you, regarding your time off of work, applying for disability? You know, there's state disability, and there's federal disability. There's work disability. You know, there's, California is extremely generous and leads the country in giving, for those of you that are still working or working, in giving you a certain amount of time off in the Family Leave, Medical Leave Act, FMLA. So all of those things, and I'll share that website for you in a little bit, but all those things need to be taken into consideration. You need a PhD in caregiving to follow all this. So, yeah, you know, you have to watch for those red flags for the term burnout, because it's important. Whether it's constant fatigue, maybe you're getting sick more often, kind of feeling numb or withdrawing from others, neglecting your own health and appointments, These are all red flags. Whoa, take a minute, stop. You need to do something different. Because the reality is, if you get sick, then what happens? So, this is where I wrote, it was you, this is where I wrote, guilt and resentment are rarely discussed. Guilt and resentment are rarely discussed. No, I'm fine. I'm perfectly fine. No, you're not. At least not at times. Maybe most of the time you are. That's great. Doesn't mean there are still some tips that would help make it better, make it different, support you more in your role. But recognizing that just because you love someone doesn't mean you're not pissed off with them. You didn't get sick, they did. You didn't plan on this life changing. It happened because of them, not you. It's okay. It's okay to feel resentment and to be angry about it. It's not okay to be abusive about it or blame them, but it is okay to recognize it and then realize if it's getting in the way. Are you a little harsher than you should be? Is it coming out meaner than it should at times? Are you too quick to go, oh, fine, I'll be there in a minute? Okay. So usually it's because you're not acknowledging, I am just angry about all of this. So what do you do about it? Snoopy doesn't really look fine, does he? Sorry, guys, I made woman the superhero here. But physical and emotional exhaustion from long days, often disrupted by sleep and caregiving, can feel like you cannot get off the couch. It's just how it feels some days. And so that's why we come up with the marathon metaphor. I wish I could tell you I coined it, but I didn't. I don't know who did. First time I heard it was 25 years ago from a social work colleague of mine in Washington, D.C. at GW Cancer Center. I saw her presentation. But that is what it feels like. And there are some practical self-care strategies we're going to talk about. But caregiving, especially long-term caregiving, requires pacing, planning, and endurance, just like a marathon. And like marathoners, caregivers need to train. That's the education. Someone mentioned that. The training is the education. We need to learn. We need to learn about the diagnosis. We need to learn about what we do about it. We need to learn about self-care. There's a lot of training like a marathoner. And then we need to hydrate, right? Well, hydrating for us could be and should be water. As a matter of fact, I was going to ask, do we have any water, you guys, that I could have? Phil, is there any water back there? Thanks, I'd love that. You have to hydrate. Well, for caregivers, hydrating is feeding ourselves. It's taking a break. It's doing something for ourselves. It's finding that respite moment, those small wins that I talked about, right? Any of that, that's that hydrating. And certainly endurance. You have to seek and find support. And thanks so much. Thank you. I really applaud you all for that. So I wipe my hands on my pants. Some things never change. I'll always be 11. You're here tonight, so you're looking for something, right? So, give yourself some kudos for that. And I think that's really important. So what do you guys, I'm going to put up some practical strategies for self-care, but so I can drink a little and take a break. What do you guys do for self-care? What are your strategies?
Play bridge.
Play bridge. Oh, you're a smarty. Oh, you play bridge. Well, you're the smarty then. I couldn't
Coming
learn.
back to it. That doesn't mean it's easy, but
It's easy.
I have that.
Good for you. Good for you. That's important. Whether it's bridge, canasta, mahjong, whatever it is, that's wonderful. Golf.
I read, and that takes me away. And I also great, because I can do it right at home, and if I need it. But I put on my calendar, I shared with somebody else, they said, oh, how do you get time for that? I said, I put it on my calendar, Monday, or whatever. It's on there, I can't make doctor's appointments on that day, or it's there.
Good for you.
On the calendar.
Good for you. Yeah, that was my big fear about even going part-time, semi-retire. I don't have hobbies. I mean, my hobbies, everyone came home from school and had milk and cookies. I was given granola and a 5-mile run. And as you get older, you can't sustain some of those athletic hobbies. So yeah, I can palm a basketball, but artwork I'm not very good at. What else?
I would often put my AirPods in and listen to music.
Music. That's wonderful. That I love. That I love. What else? Movies. Out, at home, wherever you can find them. At home. Good for you.
I will give massage.
You're lucky.
Yeah, really. He said, you're lucky.
Myself.
Good for you. That's wonderful. I think that's one of those programs Bill and his team are looking into, offering for patients and caregivers. See? See? Anyone else want to share? Yeah. Go ahead.
You talked about anger.
Mm-hmm.
I don't get angry with my wife. I get angry with the doctors, pharmacists, everybody else that don't move as fast as I want to.
Yeah.
Just
Yeah.
all the time.
Yeah. Oh, look at the heads. Uh-huh. This hand went right up. Uh-huh. Yeah.
You need a PET scan right away. Okay, how long is it going to take? Well, anywhere from 2 to 4 weeks.
Yeah.
What do you mean right away?
Yeah. It certainly, again, those of us in the room are old enough to remember when healthcare wasn't like this. I'm actually old enough to remember when the doctor came to the house. So healthcare is extremely challenging today. And I'm on both sides of it as a patient and as a provider in the world as well, and I'm married to a retired doctor. It is very difficult, to say the least. And I remember so clearly hearing my husband in his office in Fort Lee, New Jersey, and he was in the back of a big office, long, one of those long old New York, New Jersey offices, way in the back, and I'm in the waiting room, and I can hear him yelling, and my husband doesn't yell. He's from the Bronx. He kind of yells, but doesn't really yell. But I can hear him yelling, saying, when did you get your degree? You can't tell me my patient doesn't need this treatment. And I thought, he's not long to keep working. Yeah. Yeah, so it has changed for the providers as well as it has for us, and it is very frustrating, and I know that it is.
When my wife was first diagnosed, he said she needs a brain scan, but it's going to take a few weeks. I got on the phone and started calling around. I got her brain scan the next morning. Same with the PET scan last
Good for you.
I got her PET scan the very next morning.
Good for you.
Just by, and I think, why can't they do that?
Right. Right, because they don't have the people and the staff and the providers to read the scan, the staff to run the scan. Yeah, some places do, some places don't. The private, it's a little different. Remember, we have Desert Regional and we have Eisenhower and we have JFK, which is pretty amazing when you think about it. We have 3 hospitals in this little bitty valley. That's pretty impressive. They have certain requirements on how they run their practice and their office and their scheduling. They are required. These are governmental laws. The private offices, there's MRI scan, or there's some really good, great docs, but they're private. They don't have to run their offices like the hospitals do. They have more leeway. They don't have to have the amount of staff the hospitals are required to have before they can even see you. So it makes getting into them easier. It's not right. It's just reality. It's the same thing with, you practically need to go to medical school today to understand what your doctor's telling you. And they've got one hand on the door, usually, as they're talking to you. Okay, you're great, that's good to see you, get that scan, bye, and you're like, wait. So part of that is for the caregiver and for you as a patient, it is our responsibility then to be very proactive and be a good patient and ask those questions. Doc, you just said she needs a scan, but you're also telling me, or I asked, it's in 3 weeks. Is that dangerous? More often than not, it isn't, because if it was really dangerous, your doctor would be on the back phone going, Mrs. So-and-so needs the scan now, or we have a serious emergency. That's what happens. But what we hear is the doctor said she needs it now, and you're telling me she can have it in 3 weeks. So ask the question. You know, something to think about. Okay, thanks for that. So it's really important, again, these are up here for you, these slides are available to you, make copies of whatever. These are and now, come on, this is not surprise to any of you, is it really? You kind of know this. You just have to be reminded of it periodically, and then it goes, yeah, right, sleep, that's funny. You really want me to get some sleep? I'm up every hour and a half. How can I get some sleep? Micro breaks? You really want me? But notice the word micro. No one's telling you you have to go out of the house for 3.5 hours. Take a little break. Take a walk around the yard. Sit down, read a book for 20 minutes. So all of these things are really, really helpful and important. And it's for you especially to create a calming morning and bedtime routine as a caregiver will make a huge difference for you. You know, we run around. The other night I was throwing laundry and I'm coming out to the desert. I'm on the East Coast. I'm throwing laundry and I'm schlepping up the suitcase and I'm running around and I'm like, okay, I have to go to bed now. And I lay down and I'm like, I just can't sleep. And my husband looked at me like I was a crazy woman. He said, of course you can't sleep. You were just running around the house for the last 2.5 hours. Create a routine, a calming routine. If you can, get up before the person you're caring for. Have that cup of coffee earlier, that tea, that quiet time, if you can. It does make a difference. And you know, breaks can be as simple as deep breathing. Y'all know about deep breathing? You know about deep breathing, in through your nose, out through your mouth. Go in through your nose, count to 3, hold it, blow it out. That's a break right there. And you can do that anywhere, anytime. And it does make a difference.
Or just breathe, period.
There you go. There you go. That's exactly right. I keep talking about celebrating those small wins every day, but they're important. And you know, say yes to help. Say yes to help. Make a list of what you hate doing most. What do you hate doing most? Give that to somebody else. Let them do it. It could be, again, as simple as, you know, I really love the way, I don't know, peonies look in a pot. I don't have time to go and pick one up or get a bag of dirt and throw it in a pot. It sure would look pretty out on my deck or outside. Maybe a friend can do that for you. Give someone something to do, what you dislike doing most, so when they say, what can I do for you? You have an answer. You have an answer. You know, family and friends want to be included. They really do, and I know a lot of us have moved to the Valley from elsewhere. In a lot of ways, they're new friends. They're not the lifelong we grew up with on the stoop. Us New Yorkers, you know, on the stoop. But it doesn't mean they don't want to help. And we do have family, and they want to help. One of the things I learned doing cancer support groups, especially, was I would often hear, I would say, how's it going? Okay, you know, what'd your kids have to say? Grown kids. Oh, I didn't tell my kids. What do you mean you didn't tell your kids? You know, they have their own lives. They have their, I'll tell them, but just not right now. And it took me a while until I was able to say, when folks said that to me, what do you think the message is you're giving your children by not telling them? Because eventually, either you're going to tell them or they're going to find out. In my case, because of the work I did, it was cancer, but it could be anything. What's the message you think you're giving your adult children, your good friends, when you don't let them help? I don't trust you. You can't handle it. We're really not that close. Those aren't great messages to give people you care about, especially your adult children. So think about that the next time you say, I don't need anything. Think about what you're saying to that friend or family member. So we talked about for us our strategies. What about caregiving strategies? What works that could make caregiving easier? We talked about taking care of yourself and what to do. Well, there's a lot of things you can do, actually. We often just don't think about them. You can keep a binder, or for you tech-savvy folks, an app, and put all the test results and the medication and office visit notes. Do you know that your doctors write notes after every single office visit? And they are yours legally. They're yours. They may not keep them from you, not that they would. Many of them, especially the younger docs, to be honest, because they're trained to do that, they'll give you the notes before you leave.
Or it's right on my chart.
There you go. That's exactly right. They're on my chart. And if you're uncomfortable with my chart, every office has someone who's a my chart user who will help you figure out my chart. So keep a copy of all that. It helps to refer back to it, all those office visit summaries. This is a pet peeve of mine. I had the privilege when I worked here full-time at Eisenhower of working with our family and internal medicine residents, teaching them how to speak English, because they never spoke English. They all just spoke medicalese. Now there's a way to communicate. And I was so surprised to hear from them the number one thing they wanted patients to do. What do you think it was? The number one thing? Primary care, training primary care docs, residents. To a person, they all said the same thing. What do you think it was? Listen is nice, yes, but that isn't it. Write your questions down. Because this is what happens, and we're well-meaning, but we go in and we're like, wait, you know what I wanted to ask you? So my girlfriend's daughter's husband's son, he went to his doctor. What kind of doctor would he go? Yeah, he went to his doctor. And it's an important question. And it is an important question, by the way. I'm not being cute. The question is going to be important, but till you get to it, this is the reality of medicine. They don't have the time. I was at a lecture once and I said, you know, Marcus Welby doesn't exist anymore. And the people in the room had no idea who Marcus Welby was. Because they were all a lot younger than me. So write your questions down. This is hugely important. And here's the other thing. Don't keep it by your bed, on your night table, at your bedstand, because if you sleep with someone, they have to crawl over you to write their question. Keep it where the family is always. Where's the family kitchen? Keep a pad and a pencil, so not just you, your dearest, closest friends, your adult children, they can write their questions down too, but here's the real trick. The night before your appointment, prioritize them. Put the most important ones at the top, because usually you don't get through the whole list. And we talked about being proactive, be a good patient, be a good caregiver, be proactive. Ask your providers, whether that's your doctor, your nurse practitioner, your physician assistant, the MA that rooms you, whoever it is, the nurse navigator, the social worker, what's the best way to communicate and get a quick question, not emergent, not a direct medical, a question answered. What's the best way in this office? Some will say, send a my chart message. Others will say, in our office we fax still, especially in the community docs. Fax the questions over to the doctor. Someone else might say, just call us. It depends how the office is run. So those are important things we can do that will help us make caregiving more practical and easier for us. And then this is Bill's real area of expertise as well. Ask about palliative care. Ask about palliative care. You know, in this country, we have made a terrible mistake. We married palliative care with hospice. So whenever you hear it, it's palliative care and hospice. You want to hear about palliative care and hospice, they are two completely different things. Palliative care is not about facing the end of your life. Palliative care is about pain and symptom management. That's what it's about. That's what it's about. Now, you might be facing end of life and need a palliative care consult, but you don't have to be. And again, as a caregiver and viewing those practical caregiving strategies, ask about that with you. Is there a palliative care doctor or program that's here that we should be connecting with? Because I noticed we're upping those doses of medicine pretty quickly for that pain. Maybe we can have a consult with an expert in that area. Any questions? We doing okay? Hanging in there? Okay, just checking. The majority of us are really lousy communicators. You know that? We don't do a very good job of communicating. We beat around the bush a lot. We wait till we're too frustrated or annoyed, and then it comes out angry, and we really don't mean to be angry. And the person that we're trying to caregiving for, they get upset with us, and then we get upset with them, and it becomes kind of this cyclical. I don't know where the kids are. They never show up unless they need something. I could really use some help here. You guys have teenage grandchildren? Where are they? Teenagers are very capable. Oh, I don't want to ask. They're kids. No. You know what? It's a great life lesson to teach a teenager. Come and help a little bit. I could use some help with Grandpa. Nothing wrong with that, right? So if you have family, and you're fortunate enough to have family, and nowadays, don't tell me they live in North Carolina like me, because we have Zoom today. We have FaceTime today. We have all kinds of ways to communicate. It doesn't have to be in the same room. And they could do a lot of help, even far away. Do you know they can order groceries and have them delivered for you, even if they live across the country?
We have sometimes they're just too busy because they're psychologists or whatever, they have their own clients, and they're just too busy.
Mm-hmm.
In my case, I'm just the caregiver for the mother, and none of the kids live in California.
Mm-hmm.
They all live far away, and hey, I should call Jenny. Sometimes it takes 1 or 2 days to get a response. And this stuff is very nice.
Yeah. It's a reality. I hear you. You know, there's a lot of different ways to look at that. One is the cynical New Yorker. What goes around comes around. You know, where was mom? But the reality is too, and my answer often is, hey, look, your parent didn't tell you when you were little they were too busy. They took care. I know you're busy. Come on, we've all been there. I mean, we all were those younger people at one point in our lives, were we not? We know what it is to be super busy. We do. I had a 14-year-old, a 12-year-old, and gave birth to a newborn. So I'm coaching girls softball, holding a baby in a bundle like this with a little mitt on the top of his head. He shouldn't get hit by a baseball. You know, and I worked. We're all busy. I totally get that. But we could also ask them to carve out, or ask them, use clear, kind phrases when when delegating. Clear, kind phrases. What would work in your schedule? I could use some help.
I'm so busy. I got plans.
Yeah. Yeah.
They tell us.
Yeah.
Plan would work, and Joanne's so plan would work.
Yeah. I get it. Yeah. So I hear you. So could you give it some thought and think about the one smallest thing you could do? Because your parents, I'm going to leave them out in the cold if you don't do something. No, I'm just kidding. But, you know, listen, there is a reality. There are a certain amount of kids that are just not going to step up. They're just not going to.
Well, I love when they have time and it's kind of right. And then,
Yeah.
oh, good, I did
Yeah.
this. Never asked her for
Yeah. Yeah, usually that ends up in emergencies of some kind, and that's unfortunate. I hear you. I do. And then lastly, of course, is to revisit roles periodically. You know, who's doing what. I don't want you to forget the role of humor in resilience. This is hugely important, and we do tend to forget it. We really do, and there's not like great, there's not like great sitcoms anymore. Did you notice that? They're all kind of lame. You can't turn TV to find something fun. But there are some great comedians on YouTube or Facebook or wherever. But I mean, this is a fact. This is a scientific medical fact that laughter can reduce stress and strengthen connection. So where can you find that help, that laughter? Just for a moment, a chuckle, anything. This is up on my wall in my office. I often say to my social work colleagues that at times it felt like the weight of the world was on our shoulders. And it's hard work. We love it, but it's hard work. And it's important to laugh. I mean, do I think you should all be drinking? No, I can go into a whole lecture about how bad now all the studies are showing about the connection between alcohol and cancer diagnoses, many of them. But it made me laugh. So anything that can give you that break for a moment is super important. My dad was almost 6'7" and was ranked 5th in the world as a shot putter. Extraordinary athlete, unbelievable athlete. He was amazing. And he was diagnosed with Parkinson's disease. And he and my mom, their big thing was golf as they got older together. My mother was this big. Yeah, you should have seen her try to yell at me. She used to have bedroom slippers with 4-inch heels. So I was visiting them in Florida, and they came in, and they're both wet. Like for my father was his like knees or ankles. My mother was wet from her waist to her golf shoes, and they're laughing. They're laughing. And I'm like, excuse me, like what's going on? Well, it seems that they were out, and my father was still upright, and he still could hit a golf ball without falling over. And he hit a ball, and it went towards the water hazard, right kind of in the beginning of the water, a slight slope. And so my mother went, no, Bernard, I'll go. Of course, don't go down there, I'll go. And she went, and she slid right into the water. So now my father is upset, so he gets up with his Parkinson's and walks down, and he slides right into the water. Now, they could have sat there hysterically upset. How did he feel, this incredible athlete, this ex-Marine, that he couldn't even retrieve a golf ball anymore without falling? But instead, they looked at each other and thought it was the funniest thing they'd ever seen. The two of them sitting in water, laughing. So wherever you can find that fun and that laughter, it's so important, and it does make a huge difference in your attitude and how you cope with things. And since I'm talking about falling, do you have a plan? What's your house look like? Do you have a lot of throw rugs around? One of those nice runners, maybe, in the kitchen or in the hall, right? We don't like to, but if you need a cane, are you using it? A walker? You have to reduce trip hazards. Do you have grab bars in all of your showers? Right? Do you review, is your lighting good so you can see where you're walking? You know those little, have you seen them? Amazon sells them. Everyone sells them actually. The little plug-ins where the light shines down so at night you can see clear. This is for you as well as for the person you're caregiving for. They help both caregivers and the care recipients. And also, can you leave your loved one with an automated, some kind of device so they could call for help so you can get out of the house? No, you leave someone, if your loved one that you're caring for is safe, sitting in a chair or recliner, even in bed, for an hour. If they have a device that if they get in trouble, if they're capable, there you are, phone, for those that can use phones. Absolutely. So the National Council on Aging, NCAA, I think, National Council on Aging, just Google it, it'll come up. I'm sorry, I should have put it up there. It might be at the end of the presentation. But they actually rated the 3 best programs that you can buy. So these are the 3. Full disclosure, I don't get paid. I don't get anything. They're supposedly very, very good. And it's very helpful and will give you great peace of mind so that you can leave your loved one. Another strategy for being a better caregiver. And then how are you planning? Have you done your advanced care planning? Do you have an advance directive? Who speaks for you when you can no longer speak for yourself? Are you the person who speaks for the person you're caregiving for? Who's the power of attorney? What are the benefits that come with that? Where are the documents? You know, nowadays you can literally buy one of these accordion folders and it lists everything you should have in that part of the accordion folder for personal documents. Hugely important. And if you are not legally married, this is everything because you do not have a voice legally. Very important. Yes.
Hi.
Where?
Right here.
Hi.
Hi. What is FAOSW an acronym for?
Oh, sorry. Is the post up there? Physician orders for life-sustaining treatment. Sorry, I didn't even recognize. So, these are physician orders, not yours. This is a doctor order. And it's very important when you've talked about with the person you're caring for, or they're talking to you even, what do you want to do at the end of your life? What do you want done or not done? This is different than an advance directive. This is a physician-driven order that's in a chart. You can speak with your primary care doctors about it.
I have a question about
Sure.
that. I was recently in the hospital and the nurse, I won't say which hospital, the nurse, said, don't do that.
Mm-hmm.
Because then you can't, your son or your husband or you can't change it.
That's correct. That's the whole point of them. I don't know why she would tell you not to do that. If you and your doctor agree, I understand things change, but then your doctor will change the orders. Yeah, I disagree with that nurse. I do. But it doesn't mean that I think everyone should have them. I don't, actually.
The minute you said that, I said,
Yeah. You know, those nurses, they think they know everything. Don't tell my nurses I said that. They taught me everything I know. You know, these tasks are not fun. They're not fun to do. They're really not. But they are essential. They're absolutely essential. They're proxies, the financial powers of attorney. I'm so sorry. I don't know why. I guess because I'm working part-time, so half my brain goes on vacation on a regular basis. I should have ordered this for all of you because it's a wonderful little booklet. I didn't. I ordered it for myself. But it's support for cancer caregivers. But again, it's about cancer, but it's really about everything. It's caring for the caregiver. And it is a wonderful little booklet. And it is free of charge from the National Cancer Institute, NCI, nationalcancerinstitute.org, .gov. Org, thank you. Oh, here you go. It's the NIH, the National Institute of Health, NIH publication number 19-6219. 6219. It's a really wonderful little primer on what to do and how to do it. Mm-hmm.
Yeah, you talked about that there. My wife and I, just a few months ago,
Oh,
But we moved down here when we retired, but found out in California, a 30-year-old will means like nothing.
right.
So we created a trust, which is really in that process. It's not, it does, I didn't know what to feel about most, or even but all the rest of the stuff is all pretty well, you spell it all out,
Right,
for both our sakes.
right.
So one for her for me, but then beyond that, if the two of us got hit by a bus tomorrow, it doesn't matter whether they have cancer or not, you
That's correct.
deal with and all that.
Right.
So at least most of that set up in California, it's very important to have a trust just for your kids, your grandchildren.
Well, actually, really, that's true. In any state, it's important if you can, if you're in a position.
All states are different.
Yeah, but trust is still a good thing to have, period. So that, yeah, that'll be helpful. Good night, you guys. Thank you for coming. Good night. Yeah, no, I hear you. Did you say you were from Philly? Yeah, I grew up at the Penn Relays. So, really? Wow. My uncle was a track and field coach at UP. Yeah, so I spent a lot of time there. But thank you for that. And yeah, you're right, the laws are different everywhere, but everyone and anyone should have a trust set up if you can. Talking with employers. Is anyone here employed? Anyone working and employed? You're all retired? I know you two are employed. You're all retired?
Self-employed.
Okay, thank you. Otherwise, I'm pulling the slide down, teasing. You have certain rights. You have certain rights. Now, again, California is very generous, but these rights are also based on how many people are in your employ, where you work. Because if you have so many people, they're not required, your employer is not required to give you certain accommodations as a caregiver. So it's important to ask about all of this, though, and work remotely if you can, and request reasonable accommodations if you have, I think it's 50 or more employees on the reasonable accommodations. But I promise to give you this organization full disclosure. I sit on their board too. See, I'm really very busy. triagecancer.org. This is one of the best websites I have ever seen. Social workers, I'm telling you, this is great for your patients. This is a free of charge, run by attorneys, all attorneys, with all of the information you will ever need about your legal rights. And yes, it says cancer, but it's for everyone. And by state, what are the laws? Because the laws change state to state. What is your state law? Can you have FMLA? How are you eligible? How are you protected as a caregiver? Do you get what's called a reasonable accommodation at work? These are all hugely important, and this is a wonderful, wonderful website. Just won all kinds of awards.
My son is getting FMLA to come help
Correct.
us.
That's correct.
He's in Chicago, and we're in California, and none of it matters. So
Yep.
he's
Thank you.
intermittent.
Yep, FMLA.
So it's throughout the whole year,
Mm-hmm.
take like 5 to 10 days at a time
Mm-hmm.
without penalty.
Mm-hmm.
Doesn't get paid, but other than that, and come out.
FMLA is a federal law, federal medical leave, and that's absolutely right. You don't have to use it all at once. So if you have kids who live elsewhere and they are coming to take care of you, again, there has to be a certain amount of workers in that place of employment for them to be required to hold to this, I do believe. But again, Triage Cancer will tell you the real answer. And yeah.
California, though, has different California things like Sachs, so it's different than FMLA.
Well, but
California was like top federal, so
right, but we still have FMLA in California. It just gives more. California has always led the way in all of that. You're absolutely right. Thank you. Good point. Any questions about this? So those kids that are too busy, FMLA, they could come and help. So as I start to wind down this presentation, any questions you have, certainly, I'm paying attention. I'm paying attention to the time also. You know, it's a quick takeaway list. And start small. Do one thing. Let the steps add up. There's only 4 things up there. Just start small. It'll help you. You know, even an hour a week of respite. Respite's just a fancy word for rest. A break, right? Book one personal, when was the last time you had teeth cleaned? One personal appointment, just one. And of course, join a support group. This is what happens in a support group, all of this. This is what goes on in a group. Support groups are informational as well as supportive. That's where you should be getting the best support and information you can. So I think that's really helpful. You know, this is something we can all do because let's face it, the statistics show that 1 in 5 of us, if not already, will assume the role of caregiver for someone we love or care about. So be supportive in the community as well. You have a voice. You have a voice. Let friends who are caregivers know that you recognize what they're doing. Offer tangible support. Write this down and give it to them and say, hey, look, I went to this lecture. This is what they said would be really helpful. You could do one of these things. It would really help me, right? Here are some of those resources I told you about. You all have the phone number to call. We can provide this for you. You can just call and say, hey, can I get that list of resources? That would be really helpful. We'll provide, or take a picture. That's what I always do. Take a picture. Really helpful. I am required to continuously, and I will continue to remind you that I sit on the boards of some of these organizations. So that's my full disclosure. I don't get paid for doing that, but I do sit on their boards. There's Triage Cancer right up there. The Riverside County Office on Aging has quite a bit of information, by the way. I was surprised, pleasantly surprised. So there are national and local organization websites for further info. There's some technology and community resources. These can really lighten the load for you as a caregiver. Share calendars, you know, there's all that stuff online too. There's a way to do shared calendars, grocery delivery. All these things will make your life easier and make you a better caregiver and healthier for it. There are medication reminders, there's telehealth. Hey doc, can we do a telehealth visit? Now, a lot of insurances have pulled back coverage for telehealth visits. So when they say no, they're not being difficult, they're just not getting paid for their time. And doctors don't work for free, nobody works for free. So ask about that. You are not alone in this role. There is support out there for you, but you do have to go and find it. It's not just, well, actually it is handed to you tonight, here you go. So, some closing thoughts for you. Holidays are a particularly tough time, and that's why Bill decided this was a good time to provide this presentation. So thank you, Bill. Much appreciated. Thank you. But the holidays can add more pressure. Maybe you can't participate anymore, or you can't participate the way you used to. Maybe you can't travel the way you used to. Having to act cheerful at holiday time, that can be tiring. So, taking care of self, try to maintain a routine. You know, consider journaling. We had someone who shared that they paint. We love that. Not everyone shares their feelings using words. Sometimes writing them works. So try that. Try journaling sometimes. Stay in the moment, the here and the now. What's happening is what's happening now. There is nothing you can do about what happened, and there's nothing you can do about what's going to happen. So Stay in the here and now. You will get more done and you will be less anxious if you do that. Stay in the moment. Listen to your body. Take a breath. Where are your shoulders? Are they up here? Get them down, right? I saw you. Get them down. Recognize those small wins. Did you connect with a friend today? Did you enjoy having a laugh? Is your loved one having a good day? Has the journey brought you closer together? These are all small wins, but celebrate them as best you can. The thing to remember as well is your loved one is ill. They may be sad, they could be stressed, they may even be angry. You cannot absorb their feelings. Create boundaries to protect yourself. When I was working, I would say to young or new oncology social workers, picture your heart wrapped in saran wrap, in plastic wrap. It's the same thing for you caregivers. Picture your heart wrapped in saran wrap. You can see through it. You can hear through it. You can even feel through it. But it's always protected. Caregivers are the invisible backbone of healthcare. Oh, look what I did on the slide. Taking care of caregivers is not optional, it's essential. You can't drink from an empty cup. As we live longer, this generation, and I would venture to say following generations too, are looking at caregiving roles in greater numbers over longer periods of time. There is no question about that. And as a result, caregiving seems to be on everyone's mind nowadays. In her most recent newsletter to over 3,000 oncology social workers, AOSW, Association of Oncology Social Work President Linda Matthews, referred to caregivers as the heart of care, providing unseen contributions throughout any healthcare journey. Caregiving is a complex role. I will remind you of that. It encompasses love, fatigue, fear, and courage. And my friend Linda described caregivers, listen to this, I loved this. Linda described caregivers as holding the extraordinary dual role of being both anchor and sail, providing stability while navigating uncharted waters. So I leave you with this. This is a shared journey, the journey of caregiver and loved one. It's a journey of resilience. It's also a journey of hope. And I applaud you all for taking the journey together. Thank you.